Okay, I'm Jane Mabuka. I'm the manager for community-based education and services. In short, that is the Cobes program in North Coast Medical Training College. This is a program that is focusing on students in North Coast Medical Training College. And why this program is there is because our students are expected to be trained holistically in all aspects of community and theory. So we have adjoined with the community promotion, community health promotion fund. We in community health promotion fund, we have programs that create chance for our students to expose their skills at community level. We have the elderly program, which is focusing on the aging people, whereby they need care and support at the community level. We also have the child protection program, where we look at the rights of the children at the community level. We look at school health program, whereby we now look at the school children in primary schools, whereby they come and interact with our students. Then we have Mzazi na Mtoto, a project which is sponsored and supported by a sponsor from UK. This one is about in and about pregnancy. And then lastly, we also look at our program of home-based care, whereby it rides on all other programs, in that we care for the people who are having problems in their health. Now, when it comes to COPS or community-based education services, our students come at the health information point, which is a point within the community catchment area. And students, when they get there, they are exposed to the community by running activities at the hip, which is a tent that is placed at the community. Community members come in to walk in and get the services, support from the team at the hip. When you come at the hip, you will find there's a community health promoter, you have a trainer, and we have a hip assistant. Our students are also in at that hip. And what is the role now? The trainer is there to give support and guide the students as by the academics. The hip assistant is to coordinate and ensure there are available services at the hip point. The community health promoter is there to sensitize the community to come for the services, and also support our students when they go for home visits in follow-up of the clients who are at the household level. Why have we put this hip at the community point? It is why do we have the hip point in the community? Looking at the primary health care, we are looking at how best we can be able to support the community to get decentralized with our health services close to the community. And so Community Promotion Fund and North Coast Medical Training College, they have come up with this hip point so that the community can come in and check their health conditions at the tent. And when they walk in, they can check their blood pressure, they can take their weight, they can assess the children under 5s. And the reason they are doing this is that some of the services they need, they don't need to walk long distances to go and get at level 2. So the hip reduces the distance and expenses for our community, and in that way they save time for the other services at their household level. Secondly, why the hip point? It's because our students, when they're getting the theory in class, they don't have a touch as to what experience the community undergo with some of these conditions. So when the patients walk in at the tent, the trainer uh, coaches them to make sure that they also get experience of taking the vital signs, counseling the clients, and also just experience of what conditions are common at the hip. For example, patients with hypertension, when they come in, they need the checkup. And so our students have the chance, apart from the theory they learned in class, now they come in reality with a client at the hip, so they can be able to take the vital signs and experience what they are learning at the classroom level. Thirdly, having the hip point, we are also strengthening the referral system, which has been a gap between the level 1 and level 2. And so what we do is that when the clients come in and they're assessed and the condition is not appealing, they have complications, we document the condition the client has, and this client is referred to level 2, where now they can get further services and further action taken. Lastly, we are looking at the community health promoters' role at the hip point. They are very key people. As you know, they are identified by the community and they come from the environment of that particular hip. So they are the ones who play the key role in community sensitization. They are the ones who do the linkage to the hip point, and are the ones who follow up all the complicated cases, and furthermore, they are the ones who support the caregivers at the household level. Lastly, the key role that they are playing at the moment, we are very happy with them. They are doing a lot of follow-ups on the referrals from community to facility level 2 and facility back to community. As UHC program, we are calling in other partners to look at what we are doing and see how to fill up the gaps that exist. The first team that we would like to look at, the key partner, is the Ministry of Health, that we really want to see ourselves driving one goal, and that is looking at a community strategy. We want to strengthen level 1, and in that way we shall have the reduction of complications at level 1, and also we are going to decongest the queuing at level 2 and other levels. Secondly, we are calling other partners to come in partnership with NotCost and Chpf, that we strengthen the UHC, focusing on 2030. We look at ourselves to be achieving this if we can put our resources together, so that we can be able to move as a team, and we can move as a team so that we can be able to achieve the goal that is set by 2030, health for all.